My name is Eduardo Padilha and I'm from São Paulo, Brazil. For 18 years, I've been living in a region called Capão Redondo. The United Nations Educational, Scientific and Cultural Organization, UNESCO, tagged this district as one of the most violent in the world. But more than violence, me and the people of my community have to deal with poverty and difficulty to get access to education and a good health care system. Although Brazil has a public system of health, minorities and people of the periphery are often affected when it comes to accessing the system. That includes women, and the situation is even worse when you talk about diseases that are chronic or difficult to treat, such as cancer, for example. The cervical cancer is the second most common type of cancer among women in Brazil and in the world, and about 80% of the cases occur in developing countries. The main risk factor to this disease is the infection by the human papilloma virus, the HPV, that is related to more than 90% of the cases. 1 in every 4 sexually active Brazilian women is infected with the virus, and according to some data, 25% of the sexually active adults in São Paulo are infected, are carriers, or had contact with the virus in some moment of their lives. The best form of prevention is to regularly go to the gynecologist and to perform the pap smear exam. Another option we have nowadays is the vaccine against the 4 most dangerous types of the HPV virus. But one problem is that this vaccine seems to be less effective in women that have already been exposed to the virus. About the preventive exams, the costs of implementing a cytological screening program are very high, and the results are many times inconclusive, what means there's nothing you can do about that. And factors such as overcrowding, long time taken to get the test results, and lack of information are responsible for the increasing mortality rates among low-income women. But the worst part is that frequently women have difficulty even to get an appointment with the doctor in a public hospital or to get their exams done. That's why women with cervical cancer that live in communities like mine are so vulnerable, what makes this problem very worth solving. As cervical cancer is both a medical and a social problem, I believe the best way to tackle it is through both scientific research and community empowerment. I've been developing a research project, and I saw that affecting a gene related to a DNA repair mechanism that is called Ectoderma pigmentosum variant, XPV, in a cell which has already been infected by the HPV, makes this cell much more sensitive to agents that damage the DNA. So that's due to the impairment of 3 specific proteins that are very important to the cell. 2 of them are already affected by the infection of the HPV, and the third one is the protein that is codified by the XPV gene. So that opens the perspective for potentiating the chemotherapy and the radiotherapy as a way of improving the patient's quality of life and increasing the rate of death in the cells of the tumor and making them more sensitive to the treatment, such as the treatment with cisplatin, that is a drug very used to treat cervical cancer, and which is very aggressive to the patient. By talking to cancer patients, I realized that there's a lack of support groups to help these women to overcome their disease. That's why I'm proposing the creation of these groups in the basic units of health, such as this one in my neighborhood, that are the clinics maintained by the government to help the people in the health issues. The patients would be tracked by the collective health agents, that are the people who interact with the community and bring this data back to the basic units of health. The idea would be keeping control of the patients under treatment and putting them in contact with each other, so they could share their experience with people who are passing through very similar problems. Another idea is to create a platform on internet and a group on Facebook, so these women could share information about their experiences, and we could also share information about research in the area of cancer, or specifically the cervical cancer. And the women could also ask questions in private, so if they were afraid or ashamed of asking something in the front of the people in the personal meeting, they could ask their questions there. I believe that informing and integrating these women is the best way to empower them, so they can take control of their own lives and battle this disease better. That's the best way to help someone to fight a disease, is to give this person power and show they have control over their own lives.